My name is Miriam Tembe. I am the Gender and Protection Coordinator for the Idai response. I'm part of the first team to be prepositioned prior to the landfall of Idai. So we got to Sofala province 2 days before Idai landed in Mozambique. In terms of how long I've been supporting in the gender work, pretty much from the beginning, so we can say 3 months. I got to be part of the first group of people to visit the transit centers. This is after the community members that were affected were rescued from the at-risk areas and brought into public facilities such as schools and hospitals for a few weeks. And I also worked with the communities in the accommodation centers. I got to do a few distributions, initially with NFI kits. Also just working with women directly, women and men, gender is women and men, trying to find out the needs of each vulnerable community and looking at taking into consideration the difference between men and women. Well, having been here from the beginning, I can tell you that things have stabilized. However, as always, the needs are greater than the resources, and there's still a lot that needs to be done. As we all know, women and girls become more vulnerable during emergencies, and there's a need to just respond, make sure that our response programs attend to those needs. So at current, we know that about 750,000 people have been affected by Cyclone Idai, and 53% of those affected are women, yet their needs are the least met. We're talking about 0.17%. That is the percentage that is currently being allocated to women. So one thing that CARE has been pushing for is also for the donors to commit to working towards supporting the women that have been affected by Idai. So CARE as an organization is very big on gender, equality, and everything that we do we need to be able to show that it is impacting and it's also working in favor of women as it is of men. So what we've been doing in the response is we're focusing on we're doing the integration of gender in our core sectors. So shelter, wash, education, rehabilitation, and also with regards to the distributions taking place, making sure that the program design takes into consideration the needs of women, the capacities of women, and also trying to make sure that women are empowered through the process.